But if I can just say, yes, you are. You know so much more than you think.
Hello, everyone. I'm Simone,
I'm Jaden.
and we are Healers with You.
Today, we are honored to welcome Dr. Folashade Lester to Healers with You. Dr. Lester is a board-certified family medicine physician who has been caring for patients for over 20 years, treating everyone from infants to adults. Her passion lies in providing quality-based healthcare with a focus on healthy living and managing chronic diseases. A proud graduate of Howard University, where she majored in microbiology, Dr. Lester went to earn her medical degree at Meharry Medical College and completed her residency at UT Southwestern in Dallas, serving as chief resident. Beyond her clinical work, she is deeply committed to service, whether through mission trips to Nigeria, her involvement in nonprofits supporting women with HIV/AIDS, or her leadership in church and sorority Delta Sigma Theta Sorority Incorporated. Dr. Lester's holistic approach to medicine emphasizes emotional health, exercise, and patient collaboration, makes her an inspiring role model for future healthcare providers. We're excited to hear her story and wisdom today. Thank you for coming up to our show.
Thank you.
Absolutely. Hey, guys.
We've heard a rumor. Like, we just wanted to know. We just heard your bio. What were you doing in 2002?
Man, in 2002, I was, lots of things were happening. But in addition to starting my first job in primary care, I finished my residency in 2001. No, got married in 2000, finished residency in 2001, had my first child in 2002, along the time that I started my first practice. Yes,
Yeah,
all of
Wow.
that happened.
a really busy year.
A
Did you
really
like,
busy year.
do you have like a name preference for that first child or like,
Um, I called her baby girl with a head full of curls.
oh no, no, no.
Simone Pony Macaroni baby girl with a head full of curls. That's the name that I remember.
That's a
Yeah.
good name.
hmm hmm
Anyways, that's my mom. We're not trying to hide the fact that you're my mom, so we're
Not
just
at all.
getting that out there. Plus, I don't know, people might think we look alike. Like, that's weird.
Every now and then.
Could you tell us a bit about your background? What's your first sparked your interest in medicine?
If I'm being honest, sometimes stereotypes have some just a tiny bit of truth. So I'm first generation Nigerian. My parents both uh, immigrated to this country a couple of years before I was born. My father had an amazing opportunity to come here and study, and his goal was to study medicine. He raised myself and my siblings to truly just have a passion for education. And for me, my exposure to his experience led me down the road, at least I guess we'd say sparked my interest. But I truly was one of those people that, at least back in the day, this is what everybody used to put on their applications, where I really like science and I really like helping people. But it was really true for me. I really liked the concepts of how things worked within the body and how it manifested into the world and how we saw things and all of that. So just the human body and the human experience was something that even as a child was always interesting to me. And then as I matriculated through high school, I tended to gravitate more towards science-based things, more things that I could put my hands around. And I truly believe in service. One, because so much has been done for me, and then I know that my obligation as a Christian was to do for others. So it was just kind of the perfect combination of what I liked, what I enjoyed, what I thought initially, even as a young person, was my purpose to engage with people in a way that helped them physically and emotionally. So did my parents push me towards it? Yeah, maybe there was a nudge, but more really truly it was an interest of my own.
Yeah, that's awesome. And I think it's always funny because now they tell us under no circumstances are you to say, like, I want to help people. But that's the truth. Like, everybody that's going
Yeah.
into medicine is aiming to help people in different ways. And so
Right. That was the initial. I'll just say that.
yes,
That was initial.
absolutely. So we talked a little bit about education. What drew you more towards family medicine? What was that experience like? What sparked that interest?
Okay, that's an interesting question, and I'm happy to answer because I noticed here lately there seems to be a really early push towards, young med students, or even before you even get into medicine, like what kind of medicine you want to practice? And I had no idea. Um, they're certainly going into medicine. The doctors that I knew, none of whom were primary care doctors. My dad was a surgeon. The people around us were varying specialties, and I really took time to develop a affinity or no, don't like that. As I was matriculating through medical school, and I liked several parts, and then there were some things I didn't like. So I knew that I didn't want to be a surgeon, but I did like procedures, sort of small procedures. I didn't necessarily want to be a pediatrician, but I like to have children in my practice, and I like that. So I just liked a lot of different aspects of medicine, and family practice seemed to sort of bring them all together to some extent, right?
Mhm.
So, rural doctors do actually deliver babies. And so we had to be trained in that capacity, do more procedures. Did I want to go rural or not? I didn't know at the time, but I just really liked the multiplicity of what I could do. I used to say, anytime you walk into the room, you just don't even know what you're going to walk into. And I like that little surprise versus doing the same thing every day, so to speak. At least that was how I initially formulated my desire to say family medicine. But I did not go into med school with that as my particular interest.
Yeah, that's awesome. Especially like being a med student now, that's the question you're asked every day. What
Yeah.
specialty are you interested in? What specialty are you interested in? It's like this big.
And it's perfectly okay to go into med school without knowing what you want to do. 50% of the med students end up changing their specialty as they go through anyway.
That's what I
Exactly.
think everybody needs to know that.
So what does your day-to-day look like as a family medicine physician? Is every day the same? Is it very starting thing?
So in 2024, asking me that question versus back in 2002 or even 2012, it's different. It's different. My day to day, again, as a physician or just as a woman, as a person, it certainly includes all of my stuff outside of the clinic. Raising children, trying to maintain family and do your best in the world, and all of those things. I never completely leave the practice in a sense, even on vacation. Now, that's not to say that it's all particularly stressful, but you engage with people for years. I have people who have followed me throughout my, pregnant with Simone, quite frankly. So they remember aspects of my life. And so it really does become a relationship that I have with certain patients. And so I don't completely cleave from, but that is necessary to be able to have your work and to have your home. My day to day then starts with prepping for the patients that I'm going to see that day. So I'll review the charts and know who's coming in and what they're coming in for. So though initially I said it's fun to just walk in and there's something new every day. Yeah, you really want to know what you're walking into. Over time, you realize you need to know that here comes Miss Jones, and she typically has this thing, and sort of be prepared because time and the resources that we have to get through seeing more and more patients requires that we have had to change our mindset to some extent. We've had to change how we practice medicine, being able, as I've gotten, let's just say a little more mature, being able to be more tech savvy so that I could manipulate, the computer and the electronic medical record. It's certainly changed over time. I think for if you want to say generation of doctors, some of us have either, stepped up to the plate and the challenges of the new continuum that is medicine. And some decided, you know what, I think this is where I'm going to kind of move to my second career phase, if you will. So it's been a challenge to stay abreast of not the body itself, because we have CME, we engage with peers in terms of the the science of it. But the practice of medicine has changed quite dramatically over the last 10 years. And so stepping up to that challenge every day means something a little bit different, quite frankly. So my day has changed because the practice of medicine has changed to some extent.
Kind of going with that, what do you think has changed? Or like, where do you think you've seen the most changed in practice of medicine?
Well, there are more resources. I mean, we jokingly say that, patients Google everything before they come in, and they already have their answer. They already have the medicine they want, the test that they want. And so, yeah, I did my research, and this is what I found. And, there's certainly, that's amazing that we have technology and that people are getting more vested in, in, in their health and what's wrong with them per se. I just want to encourage people to understand that not every study is a valid study. Not every commercial is giving you the pros and the cons and the ins and the outs of the whys, right? So we're having to combat that a little bit more, but it's also a good thing that we can share with them. They don't just have to take our word for it, but we want them to take our word for it and then go and research it from there, as opposed to bringing in, this is what I know, let's just talk about it a little bit more. So we do find that, I find, I guess, that patients that have, been with me for a long time, there's a trust factor that is there. And I think we live in a culture where there's a lot of distrust of the system. And so we're the face of that sometimes. And what I enjoy is being able to talk people through it. And I enjoy us, if you will, collaborating on their health. I enjoy that they are wanting to be more engaged with it. And so for all intents and purposes, I really think it's a good thing. Just everything needs a little,
good things,
little
in
massaging, if you will.
moderation. Exactly.
Moderation. There you go.
Patient education is very important, but it's often like disheartening to come into a patient's room and they don't even know what illnesses that they have. They like the doctor has to tell them, even if they already had a diagnosis or something like that.
Yeah,
Exactly.
experienced that too.
And that's what they come for. I kind of, people ask me in the past, well, if you weren't doing medicine, what would you do? It would be teaching. I mean, and that's over time when is this what I'm supposed to be doing? Yes, I know for sure. And I know for sure family medicine in particular is what I'm supposed to be doing in terms of my purpose, because I believe my gift is in educating. You can teach science, you can teach biochemistry, you can teach people about their bodies, right? Now it's their body and they know it, but let's collaborate on, well, why do you have this rash? Where did that come from? And not just put this cream on it, and not put this cream on it, and next time don't do this, or let's figure out, what the trigger was. And so therefore, so that's the preventive piece of it, as well as the education piece. And that's what I truly enjoy about family medicine.
So how would you describe your work-life balance, and what challenges present themselves with working as a doctor and also being a full-time mother, a wife, and all of that?
Maybe you ask my kids that. I don't know. know how well we've done.
That's hilarious.
But certainly it has afforded us, and I don't mean just financially, but the opportunities to engage and network and be available for our community to a certain extent, and be hopefully trusted in that space. It's given us opportunities to allow our children to see more of the world. And I don't mean all over the world, but just outside of our street corner, if you will. I hope that, well, I don't know what I hope. What I'm trying to do is make sure that, they see that, first of all, you don't have to be a doctor, but we do want you to be of some service in our community and some service in our world. So trying to keep always God first, family second, I guess work third. I feel like even that may even be a little too high to some extent, has been the goal. And it bleeds over. It really does. In the early part of, because my husband's also a physician, in the early part of our marriage, he's an internist and was a hospitalist. And that back in the day, it's morphed a little bit now. That was sort of a glorified ongoing residency from my perspective. He was always in the hospital, and so you can't just, it's 5 o'clock, I'm leaving, because the patient still needed care. And so that was very trying, if you will, to not have him present in the home, but still working and still engaging with our family, of course. And me also doing just a different version of medicine, more of this is 9 to 5, but you got to be done from 9 to 5. Like if it spills over after 5, then that's the problem, because you got to pick up the kids. You've got to, be at the play. You've got to do all of those kind of things. So it has certainly been a challenge. Some of my colleagues in med school, a few of them had lives beforehand. They were older, if you will. They had careers, or they had chosen to have families and children, and so they came in very focused because they didn't have time to play. They had to get home and versus the majority of us were coming straight out of college, and we had a great time in med school. It was fun. I won't say fun, but we enjoyed life while we studied hard and pushed each other. So for those who sort of delayed the family process and were sort of in the thick of their career and having children, versus those whose children were now older and now they were starting out after medicine, it's different. It's been different. And I encourage people to think about that. I feel like the continuum has shifted to some extent, where it seems like more people are taking some time to grow and have families or do life, if you will, before they go to medical school. And, I don't know if that's better or not, but it's certainly different. And I hope that would lead to a little less tug on, especially women and medicine, if you will, a little bit less of a tug on that work-life balance, because it's a challenge.
Yeah.
Yeah, now the average entering age of a medical student is now 24. So most people aren't even going straight through. I know from Simone's experience, like she's the youngest person in her class.
I'm one of the youngest in my class, just because I did go straight through. And so it's like it's a blessing also, because we also have that experience of like, everybody has a different experience in life. A lot of people came in with other careers, or we've got some former nurses in our class and stuff like that. So everybody has their different strengths and weaknesses. What I really liked that you said was that the balance is ebbing and flowing. And I feel like that's also something for med students or pre-med, wherever you are. I think that we think of a balance as a static balance, but balance is always, tilting in one direction or the other. And you just gotta, know when to put some things on the other side to balance it out.
So I'm certainly I've been in that phase of my career for maybe the last, 10-ish years. Maybe 5-ish years, where I'm not as tethered, I guess, to my children, because they're growing up and they're making their own decisions and they're doing this thing. Science, or I should say medicine, is changing in a sense where you don't have to physically be in the office. You could be on vacation and do televisits. You can, so it's ebbing and flowing. I think that's a good way to put it. And also, if I can say just one thing, when I said we had fun in med school, I'm not saying it was easy. It was not. It was actually very, very hard. But we were all in it together. We got really close, some of us. Some people are sort of more of the loner, but for me, it was a great opportunity to bond with people, and we're still very close to this day. We went into various forms of medicine, but we can reminisce, and we can still cry and support each other and all of the things. So I do encourage people to not be overwhelmed by the amount of time that it will take to go through. People are like, well, how long were you in school? Oh my God, I can imagine. You keep living. I always say that we kept living. We kept living. People got married. People got pregnant. People, it was we didn't stop our lives. We just kept living.
Yeah.
While we studied.
Amazing advice that I try to instill, that she's instilled in me, but I also try to live out of yes, med school is a part of my life. I don't want it to be my life. I want to continue living my life while I'm in school.
And I think schools are looking for that too. I think admissions are looking for people who can keep living.
They're looking for people at the end of the day. Doctors aren't just like robots who just okay, they have the 4.0 GPA and a 520 MCAT, and all they do is study. They they need to be able to relate to patients, and a part of that is
Yes.
having a full life,
Yeah.
It's
Yeah,
important.
that
It's really
relatability is
important.
real, especially in primary care.
So I know like as a med student, we like are learning so much and it still kind of feels like I'm just a first year, so it's like different. I can't speak for second and third year, but it feels kind of like, will I ever know everything? So the question is, did you feel prepared when you were done with your training? And then like, what do you think prepared you the most?
Well, I think, again, and I kind of, I'm more of a visual person. Every time you walk into the room, I mean, you knock on the door, you open, you don't know what's in there. You can look at the chart and whatnot, but the chart may say here for follow-up for hypertension, and they're like, oh, but doc, I got this, that. And there's always that like, what? I wasn't prepared for that. But the reality is, you just are. Initially, there's someone that's going to check behind you. So there's some reassurance of that. You have an attending, somebody's going to like say, no, that's wrong. So it helps you grow in that. But if I can just say, yes, you are, you know so much more than you think. And your desire to help is what will lead. So even if that one particular rash is not something you are familiar with, or that whatever they're trying to describe about how their ear twitches and it turns this way. I mean, yeah, that desire to help them will cause you to call on what you know, and it just is going to serve you. So if I would just say, relax and just flow with what you know, and it's more likely than not to be they want to be heard, and so the more that they feel like you're vested in them, they're going to keep telling you things that will help. So, it's kind of like almost a detective type of a scenario. Like, well, it only happens when I sleep. And okay, well, let's talk about your sleep. And you just kind of keep going, and the answers are typically going to be there. Obviously, there's some things you just got to remember, right? And they've been drilling that into you in med school. So, was I prepared? I didn't think so, but I certainly was. And you guys will always be as well. You will be. And then, you know, there are other people that you can ask questions. You can refer. You can ask a colleague. You can what's that show where you have you can call on one of the
Phone a
three.
friend?
Yeah, phone a friend. But more often than not, seriously, you know exactly what you've been taught, and then you grow in that. So then you walk in hi versus hi. It just becomes easier because your confidence grows, and yeah, it'll be fine.
What was the biggest challenge that you faced during your training?
Again, I said we kept living, but it really was hard. I think it was in medical school, or maybe a little before in college, where I learned my learning style. And I think everybody has got to have a better, and then even when you think there are some things that you're just going to have to learn a little bit differently. Some things are just rote memory. Some things, I realize that I'm a visual person, so I have to write it and see it. And I like, pictures and 3D and that kind of stuff. So learning how you're going to best absorb that information, ideally, you want to have done that before you get to med school. But even if you haven't, then keep working through how best. And if something's not working, change it up. Some people work with groups. Some people don't need to work with groups. Some people like to write it all. Some people need to be in the lecture. Some people need to read it themselves. However that fits. So that was an initial struggle for me. I think in residency, for sure. And again, I'm family medicine. So family medicine had to rotate through all of the different departments. So I was a surgery intern. I was a OB intern. I was a pediatric newborn intern. And the hours were tremendous. Now, since then, this is one of the beauties. They don't make y'all do that. It was insane. The amount of hours that you would go without sleep. So the sleep deprivation and all that was really, really tough for me my first year of internship. Not that I wasn't prepared out of med school, just all of those hours. So my sleep, and those who know me know that I love my sleep. So I have to get my sleep if I'm going to function. And I think, thankfully, people are, acknowledging that you don't have to be hazed, you don't have to be beat down, to, and then you're actually going to be better people, better doctors, more empathetic, more engaged, more more on top of your game if you are taking care of yourself. So that's something that I had to learn. So if I have to pick the biggest thing, learning how to take care of myself as I take care of other people. And so that's my mental health, my sleep, my nutrition. You just can't run on fumes like that. So I hope that is being encouraged, and I think it is in the new teaching of our medical profession.
Yeah, I think residency programs in general are getting better and better as the years go on. I think some residency programs are even starting to be like unionized and getting like better benefits and stuff like that. So hopefully we're moving to like a better system.
Yeah.
So you talked about training, you talked about you know, your challenges there. Are there any specific challenges related to you being a Black woman in medicine? Can you talk a little bit about that experience?
Okay, so that's a good question. So as awesome as it is that I see a lot of attention being brought to the forefront about the need and the plight of more African American or just not just African American, but people of color, taking care of people of color. We know that lots of studies are showing that the outcomes are better and all that. So we're getting a lot of attention, but the numbers are still very, very low. So for a lot of us, myself included, we're still the only ones in the room, only ones in the whole system sometimes, or there's well, at least we're in the room. And so learning to have a voice in that room that is not just yours individually, but unfortunately or fortunately, you are needing to make sure that our voices are heard, or at least making sure that there's some, because very well-meaning people who don't have the marginalized experience, who are not as comfortable around people that don't look like them, if you will, they mean well, they just don't know. So this is an opportunity to just, hey guys, we're all here. Let's talk about it. Let's make sure that they have at least someone in their lives that can show them that we're just all the same. So there's that. But it's hard. It's hard to just be the only one in the room sometimes, right? So there's a growing community like local medicine, which is an awesome community of African American female doctors throughout the country. It's awesome. I'll just say that. So we support each other in that. So that's nationally and then locally. So it is good to make sure that you engage with people that look like you and that don't look like you, because we need to be supported and we need to support each other. But we also have to be seen and work with those who are not necessarily as comfortable, especially in recent years with the Black Lives Matter necessity, if you will, to make sure that people understand that there's been a large sort of shift in the mind of patients as well. They are looking for us. They're looking for women, and they're looking for women of color because of the empathetic nature that we have, the caring spirit, all of that. So it's a blessing, and it's something that I'm excited about and proud of. But there is some weight associated with, how we have to portray ourselves and still yet be true to ourselves and comfortable in our own skin and say what we need to say, how we need to say it sometimes, and that can be misunderstood or directed in an inappropriate fashion, I guess. So anyway, it's a wonderful thing. We just need more people that look like y'all.
Yeah, that's exactly why we have this channel.
Exactly.
We believe that Black doctors make Black doctors, the exposure, because a lot of Black people a lot of people that I've talked, especially like young people, they don't even know that these opportunities are available to them. So once they are able to see, especially like stuff like this, an interview with a primary care physician, hopefully this interview will inspire more people to pursue medicine, especially people of color.
And that's part of, not just in medicine, but just in general. We are not here to be in isolation. We are here to be in community. And so my capacity to bring someone else along we used to know each one teach one, pull somebody up. It's not just cliche. It's real. It's really real. And so understanding, and so I say sometimes it's weight, but it's also privilege. And we have to acknowledge that there is going to be privilege that is afforded to us as physicians. And so that can't be held to ourselves and our immediate family. We've got to spread the wealth. We've got to spread literal wealth, but just the knowledge, the networking, the opportunities that come that you won't know about, but I might just be that only one in the room. Right. I had a patient just last week that we were talking, and she happens to work at so I'll say it. She works at Toyota, which is they've got one of their headquarters here. And we just were talking, and I was talking to my son. He's an engineer, or he's studying to be an engineer. And oh, well, we have internships. And so that kind of stuff, we've got to keep talking. We can't just hold this in for ourselves because, one, we can't use it all. It's literally meant some of the things that we have gone through, some of the education that we have, some of the resources that we have. It's not even for us, it's for someone else. But if we don't share that we have this information, or we're at least able to talk or have dinner or invite people over, they're never going to get the information that they need. So, well, I won't say they won't ever, but it's going to take longer if we don't just start sharing. Hopefully, I appreciate this opportunity that you guys are giving people to know and to share as well.
We say all the time here at Healers with You, what do? We lift as we climb. Exactly.
There you go.
Yeah, we acknowledge that like this is a privilege to be wherever we are right now, and it's like we didn't get here on our own, and so we, like you said, share the wealth, spread the wealth. It wasn't just for us. Yeah. You kind of touched on a lot of aspects of your job, but what would you say is the most rewarding part of your job?
Oh, for sure. I mean, and I literally kind of like, I get a little, when a couple of things. When a person comes back, I've not seen them for 6 months or since their last physical the year before or whatever, and they remembered what I said and they put it into action. I remember when you said da 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 da, and that I mean, because so many times you just feel like they're just blowing me off. Like, yeah, let's work out, let's exercise, let's talk about this cholesterol, let's get your colonoscopy, that kind of stuff. And sometimes, they attribute it to me, and I want to be very quick and very careful to give God the glory for putting that on my heart to even say that to them so that they can go do what they needed to do. And then, so I love it when they heard me. And I think communication is so clear. I mean, it's so crucial. And that's why we've got to keep talking, because they won't hear. Sometimes people have come back and said something like, well, you told me this, and I was like, no, I didn't say that. And so it kind of becomes a little bit of back and forth. Well, no, you said that. No, the reason why I know I didn't say it because I don't believe that. So I know I couldn't have said that, but that's what they heard, and that's what's important. So feeling that there's been an effective amount of communication is that. And then the second part, or maybe the biggest part, is real-time talking and the light bulb goes off. Sometimes I think, there's certainly not a confrontation, but well, Google said, well, let me tell you what Google didn't say. You Googled headache and it said aneurysm, and it said sinus infection, and it said tumor, and it said glioblastoma, and it said, hydrocephalus. It said all of these things, and they're asking you to choose one. They're not giving you the context of why this headache is just a sinus infection or this or whatever. And so helping them understand and clear out some of the noise behind what they're hearing and reading and seeing in places that are not giving them all of the context or the content that they need. And so there's that, and when I see that, that brings me joy. So just knowing that I'm being an effective communicator, I guess, would be the best part of what I'm doing.
Now, we talked about some of the challenges that you had, and we know that this can be a very long and challenging path for anyone who chooses to pursue this. But what keeps you going? What gets you out of bed every day? What keeps you motivated?
Not to be cliche or whatever, but God, let me help somebody today. Let me not miss anything. There's a little bit of fear, like I don't want to miss when so-and-so comes in. And was it costochondritis? Was it just that their muscles of their chest were hurting? Was it the actual heart attack? Was it their lungs? Just not wanting, knowing that this is what I'm supposed to be doing and trying to take it seriously. And so being a doctor, being a mechanic, being a whatever, I don't really see myself, again, there is privilege being, having the credentials behind your name, and the world will give you that, so to speak. But everybody's got a role to play. And I just think this is my role. And so to the extent that I'm supposed to be out there sharing it, doing it, that's what it is. And I will say, for those thinking about going into medicine, please, please, please rethink it. If it's for the title, if it's for money, if it's for the accolades, because it's there, but it's not what it used to be. It's not. They don't just come to you again. They'll go to Google. They'll go to, their friends. They'll. It really needs to be a calling because it is hard. It is hard. It's the challenges of not just the care of medicine, but the business of medicine. We don't have nearly the time to talk about that. But if you're thinking, well, yes, I'm going to have this, amazing income, and you hopefully will and should. You certainly should. I'm not implying that that's not, but that's not going to keep you motivated, because you're going to be dealing with actual people with actual problems who are dealing with the world in ways that we don't even know and we can't even understand. And so to be prepared to engage with them on a daily basis, you want to be motivated by something other than the dollar.
Our next question is about the legacy that you hope to leave. So what would, as a Black woman, as a woman, as you, what is the legacy that you're hoping to leave on the field of medicine, on the world?
Yeah. So, again, I'm kind of I'm on that other side, if you will, or heading towards retirement, quite frankly. Not today, not tomorrow, but, certainly fewer days in the practice of medicine than there were when you were born. I want for more people to be able to occupy the space. There was a time where I was going to close. I'm trying to think of what was it I was doing. Something major that I was going to be doing, and I was going to be moving to doing something else. I think I was just closing my personal private practice and moving to or joining the group that I am currently with and have been with for the last over 10 years now. And some of them, I think the insurance wasn't going to be, they don't take the insurance. There were some reasons why some patients weren't going to be able to follow me. And I was distressed, like, oh my God, what am I going to do? And I can't not do this. And then I'm like, no, they're going to be okay. These people are going to be okay. But will other people come into this space and hopefully be able to, they feel comfortable communicating with them? Because it's really all about that. I mean, we can all write the prescriptions and order the tests and do the procedures, but if we can't communicate effectively with them, they can't feel comfortable enough with us to tell us, because sometimes they're just pointing to a particular thing when it's really way more to it. There's something going on at home. They're depressed. They are, they're having anxiety because of what's happening. So getting through that, kind of digging through that is what I think is most needed. And I think it's something that I try to do a lot. And I hope that whoever's going to occupy these spaces, AI won't be able to do that, guys. A lot of the, taking it out of the mind, the brain, and putting it in the computer, I don't know how we're going to get the warm and touchy feelings out of that will really get to the core of the problem. And so that's what I just want to say. We got to continue to focus on doing that part.
Okay. And then our last question of the day is, what is some advice for some young pre-med college students or even medical students? What's some advice to leave the audience?
One, it's not that hard. It is hard, but I feel like I think we're made for hard things. I try to tell my kids that we're made to do hard things. The easy stuff is easy stuff. So I think there's so many people that tend to shy away or feel like they can't do it. But knowing that that's what you want to do, then, get a group of people, get a community around you. You can't do it alone. for me, it's my faith for sure that has brought me this far. My family has certainly been integral, but not everybody has that. So, but look for someone that's going to partner with you in some aspect. If it's a professor, if it's a teacher, you're not going to know everything you need to know, even to get into the door. Forget what you'll need to know about the body and the blood cells and the brain cells. You're not going to know everything you need to go. So things like this is wonderful. This Healers with You and the information that y'all are bringing to people. But we have got to share this information so that people know that it's a thing that is plausible for them in their lives. So many people like, no, how many years did you go to school? Not that bad, guys. And you keep living. You really do keep living. So there's that. Take care of yourself. Don't go into this strictly for the title of doctor behind your name, or in front of your name, sorry, MD behind your name, DO, whatever. Make sure this is what you want to do. Go shadow people, go talk to people. Don't be afraid to change if that really isn't. If someone else is pushing you to do this, make sure this is what you really want to do. And then for those of you who are in med school, really look broadly at the life you want to live, in accordance with your career path as well. Albeit from a financial standpoint, how much time are you going to spend with your kids, or your relationships? Make sure that those things are prioritized above the actual job, any job, not just medicine, because that's where you will find peace and joy and the sense of accomplishment that you're doing what you're supposed to do. I think it's not going to be as legalistic as what's on the paper. It's how you're feeling in your heart and in your spirit. So please engage and invest in that as well.
That is awesome advice for sure. Thank you so much.
Thank you for having me.
Thank you so much for coming on to our show today.
Thank you.
Absolutely.
For sure. Thank you
Absolutely.
for sharing all of your wisdom, all of your advice with the world. Thanks for being my mommy.
All of that.
Love you.
Mwah, mwah, mwah. Simone Pony, baby girl, head full of curls.
Okay. Anyways, thank you guys. Thank you for being here, Mom. Thank you.
Of course.
Sorry, Dr. Lester. Thank you for being here, Dr. Lester.
Right.
And thank you everyone for watching. Please let us know if you have any questions, either for Dr. Lester or for us about where we are in our journeys. Like, comment, and subscribe. Let us know if you have any questions down below, and we will see you next time.